Cabarrus County, a Community Health Assessment by Hallie Bean, Ashlyn McCoy, Stephanie Perino, Tanya Poor, and Carrie Weyerbach. Cabarrus County, North Carolina is located in the Piedmont region of North Carolina. It's off I-85 north of Charlotte and about an hour south of Greensboro. It has a population of over 200,000, with about 24,000 of them elderly. Concord is the largest city and the city we will be focusing on for this study. We decided to look at the disadvantaged population, those who live in poverty and preventable diseases. You will see how we decided that throughout this presentation as we take you through our windshield assessment, our demographics and data research, and interviews we had with key informants in the community. In Kannapolis, which is another city in the county, there is the health department, which has recently been rebranded as the Cabarrus Health Alliance. One item that was significantly noticed during the windshield study is that construction is going in and around Cabarrus County. It makes accessing healthcare difficult, especially for those who rely on public transportation or walking. That is our elderly and lower income. There are some community resources such as parks with athletic fields and playgrounds to promote a healthy lifestyle. And we have a hospital in the county called Atrium Health Cabarrus on the left, and on the right is the largest primary care practice in the community. The average age in the county is 37.9 years, with the median household income of $60,716. Over 11% live below the poverty line, and of those, the majority are women in the 25 to 34-year-old age group. English is the most common language spoken, followed by Spanish. About 8% of the county is foreign-born, and those who are foreign-born tend to be a little bit older. Their average age is 41. About 10% are without health insurance if they're under the age of 65. 68% of the county is Caucasian, followed by African American, Hispanic, Asian, and then others mixed races. The county has a robust public school system with 7 high schools. The graduation rate is 87.5%, which is higher than average, and 40% of students qualify for free or reduced lunches. Higher education is available in the county through a health sciences college and a community college. There is a UNC Charlotte, which is just in the next county over to the south, and about 30% of adults hold a bachelor's degree or higher. Because of all that focus on the health services, or the other way around, because of the need for it, the largest employment sector in the county is healthcare and social assistance, followed by retail, trade, and manufacturing. The unemployment rate was 4% last year, and it was a decline of manufacturing. The county was previously known for its textile mills. 70.8% of people own their own home, with the median home value being $180,000. Average rent in Concord, the city of focus, is $858 per month, and for affordable housing units, only about 5,000 exist in the county. That makes it a struggle because more than 10,000 families require those affordable housing units. So much so that last year in Cabarrus County, 540 school students were considered homeless. This doesn't even consider those who are infants or in preschool. Who lives in poverty in Cabarrus County? Well, in Concord, it's 11.9% of the people. It's women, it's African Americans, Latinos, people with disabilities, elderly, and unemployed. There are challenges of living in poverty. The cost of healthcare increases as you go up, but Social Security benefits don't increase appreciably each year. In fact, the average benefits is only $1,400 a month, which comes out to about $17,000 a year. If you go back and consider that the average rent is $850 or so a month, you only have about $600 left to cover your cost of food, insurance, healthcare, transportation, utilities, everything. That does not go far. The top 10 causes of death in Cabarrus County are listed in order on the screen. Cancer and cardiac disease are, of course, the top 2, but notice that unintentional injuries is quite high. That does include drug overdoses, and the pneumonia and flu-related deaths are high as well. Other health issues in the county, the suicide rate is higher in Cabarrus than the state average. Opioid deaths are higher, drug poisoning deaths are higher, and childhood obesity is something that the county is concerned with. 2 physicians were interviewed for this research, and one is an epidemiologist and one is a family health physician. They mentioned that some key health problems that they think is the access to health care and transportation, the financial constraints that people are living within, the history of textile mill workers. We mentioned earlier that a lot of older people used to work in that industry. People still smoke, and morbid obesity. What is the cause of those higher than average flu and pneumonia death rates? North Carolina's average was higher than United States, and Cabarrus County was even higher than North Carolina. So why is it concentrated? The physicians speculated that it's due to underlying pulmonary lung diseases, could be related to that history of working in the textile mills, smoking, and unhealthy lifestyles. Drug overdose rates, again, we are above average and not in something that we want to be above average. The national rate for drug overdose deaths is about 10.8 per 100,000. State average is a little bit higher at 12.9. Cabarrus County is 19.8, so almost double the rate of the national average. You know, the county lies on a major interstate thoroughfare. People here tend to die from heroin and narcotic overdoses, and polypharmacy is a major problem for the elderly. Usually these type of things are unintentional. Beverly Cox is a nurse at a local adult day health program, and she serves people in the community, such as those with dementia or intellectual disabilities or physical disabilities, who still live at home with family members but need some support during the day while those family members are working. And she identified the concerns that there's a lack of awareness for community health support services in the community. People aren't aware of where they can go for help. Access to flu shots and understanding the importance of it. She still has people who decline the flu shots, and is even with education, they feel that they don't need it. And transportation to healthcare. Transportation is an issue because the county is spread out. Again, about 80% is rural and suburban, and 20%, the other way around. 80% is suburban and urban, and 20% is rural. So it makes it difficult to get to where you need to go. So the targeted community was for Concord, North Carolina. The vulnerable population are those who are living in poverty, economically disadvantaged. And the 1 and 2 of their top health issues are the high rates of vaccine-preventable disease and substance abuse and overdose. Some strengths that the county and the city hold is that they have a lot of local free clinics and services. They've initiated lifestyle medicine in the local healthcare system, which is looking at the overall health of patients and lifestyle changes that will preventatively improve health. There are local pharmacies offering vaccines at varying prices. There's been a decrease in the prescription rate for opiates. There has been some substance abuse treatment for prisoners. Narcan is now available with all EMS and some first responders. And there is a new program called Certified Peer Support Specialist, and the CPSS work directly with those suffering from substance abuse and help them find the appropriate level of care. Community health weaknesses include limited access to transportation, lack of affordable insurance. If people are trying to go to support meetings for NA or AA, those aren't always available during the night or during the day when people need them. There is a high rate of overdose in Concord, but there's no inpatient substance abuse facilities in the county. People actually have to go up to Guilford County to try to find more inpatient services. Community Nursing Diagnosis 1, Readiness for Enhanced Immunization Status among Lower-Income Residents of Concord, North Carolina, related to limited access to health care, history of mill work, unhealthy lifestyles, poverty, high rates of flu, pneumonia, and related deaths. We're looking at some primary interventions for them, including education and affordable immunization clinics. Increased testing would be secondary interventions. Hand washing and PPE availability falls under that as well. Tertiary interventions would include the promotion of healthy lifestyle, such as in that lifestyle medicine or the parks in the community, and reduce rate of transmissions. Community Nursing Diagnosis 2, Ineffective Health Maintenance among Lower-Income Residents of Concord, North Carolina, related to local treatment options that are limited, lack of affordable insurance, limited transportation, and high rates of substance abuse and opioid-related deaths. Primary interventions include educating children and teens on dangers of addictive substances, having classes for the healthcare providers to provide education and destigmatize some of these concerns. Secondary interventions provide information on mental health services and locate and help children who are at risk. Tertiary, facilitating transportation and encouraging more NA, Narcotics Anonymous and Alcoholics Anonymous meetings. In conclusion, the poverty level in the county is 11.5%. Access to health care and transportation continues to be a major issue, and the main hospital is trying to help with that. As we mentioned before, flu and pneumonia death rates are higher than both the state and national averages, as are the drug overdose rates and suicide rates. There are many opportunities for RNs to make a difference in Cabarrus County, and we thank you for listening to this presentation.